Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Critical Element Pathways related to infection control. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. So if you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week will be a replay session of our recent webinar on increasing infection prevention with interactive education, followed by a live Q&A. So if you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guests today, Deborah Wright and Jennifer Brown. Deborah is a quality improvement specialist at Quality Insights. She joined our team after being in the long-term care industry for more than 30 years. She has a wealth of experience in long-term care nursing and management, ranging from certified nursing assistant to vice president of healthcare operations. And she's most passionate when working with the MDS process and quality improvement. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 11 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has led several quality improvement and infection control initiatives in acute and ambulatory settings. Jen and Deborah, thank you for joining us today.
Thank you, Kathy. So we are going to get started with the critical element pathways. And the first thing that we wanted to show you is how to get to the critical element pathways, because so many times it's hard to find it, and you may Google critical element pathways and you're trying to find it, and it's not really called that when you're looking for it. So we just wanted to go through some screenshots of how you get to that. So the links will be in the slides that Kathy will send out later this week. And this is where the link will land you. You're going to go all the way down to the bottom of the page, and you're going to click on the survey resources, and it's a zipped file. So then when you get the zipped file, all these things will be opened, and you want to click on long-term care survey pathways. So that's kind of where the critical element pathways comes in. It's just pathways. And then there'll be a whole list of options of different critical element pathways. They have them in a Word document as well as a PDF. We kind of broke the list up here because we're going to talk briefly about the general, and then Jen's going to go into depth into the actual infection control and immunization pathway, just so you can see how the pathways work and how you can use it at your facility. The one area that we have heard from you all in regards to previous post-webinar sessions is more information on the facility assessment. So the facility assessment per se does not have a critical element pathway, but if you use the general one, it will help you identify, which you already probably know without doing the pathway, but it helps you identify what's the demographic of the population that you're serving. Another thing that you want to use as you're preparing to do that facility assessment is look at your resident roster, the CMS 802. It was last updated in October of 2023. So if you want to know if you have the latest one, you can click on the link. The date at the bottom should say 10/20/23, but the biggest difference from the previous version is the last column should have that PTSD trauma category that you can identify residents with those diagnoses. So you work through the critical element pathway, you look at your 802, and then we kind of did some digging to find some free resources for you to complete your facility assessment. So when you get the PowerPoint, you'll have these links. I'm going to try to do this now without Kathy's help. I'm going to get out of the PowerPoint, and two of the free resources that we found, one was within the quality improvement organizations, And when you click on that link, it'll bring you to this page. You go all the way to the bottom, and there's a place where you can download an optional facility assessment tool. And I'll show you what that looks like here in a minute. The other website that we found was from Nursing Home Help. So when you open up that link, it brings you right to the facility section of their website. You go to the bottom, and there's downloads, the facility assessment tool instructions, a locked version of the facility assessment tool, and an unlocked version of the facility assessment tool. So what do these two tools look like from these different organizations? The first one from the Quality Improvement Organization is more of a workbook that you kind of work through and answer the questions. The one thing I will point out is to make sure that while this is an example, you need to make sure that you're following your state specific and the federal guidelines for any of the areas. And not to scroll here real fast, but I wanted to get to the one area to show you what I mean with that. But there's a section as you're going through the facility assessment tool that talks about your staffing, and it gives examples of ratios. Just make sure you're following the ratio that is current for the time period that you're reviewing your facility assessment. The other example, this one's much more detailed, but it definitely works you through what types of things you have going on in your facility. So it talks about the facility profile as a whole and the staffing levels that you have, the population. And while this looks like the 672 that we used to fill out, while we don't have to, this isn't required anymore, it's still a good tool to use to determine what type of residents are you taking care of? What type of conditions are you taking care of? So that then when you get over to the care and competency, you know that, okay, I have a high number of Foley catheters. I want to make sure that I have catheter care competencies, not only for my nursing assistants, but also for the nurses that are managing that catheter. So it has all these different areas to make sure that you have your care and competencies. And it just goes down through all different things that you can look at as you're evaluating your facility assessment. Goes into environmental, the physical layout of your building, the services that you provide, ethnic and cultural considerations. So these are all things that I just wanted to point out when it comes to the facility assessment, that while we don't have a tool per se, that, let me get back here to that. I'm gonna have to start over. For facility assessments, there's lots of different resources that you can pull from as you're creating the facility assessment for your facility and the population that you serve. So that was just a quick overview of how you get to the critical element pathways, resources that are available for facility assessment. And now Jen's going to dive into how do you use the critical element pathway. And we're going to use the infection control and immunization one as an example.
All right, thanks, Deb. All right, so today I'm going to be talking about the infection control critical element pathway, which includes immunizations. So this document was given to me by one of my mentors as a brand new IP. I was new to nursing home infection prevention and very, very nervous about my first survey. So this document is really, you know, the advanced copy to the test, so to speak. So it's been invaluable in checking, you know, what kind of things you really need to look out for when you're going through your infection control program. Next slide. So so this document, you know, the surveys use this document to guide their evaluation of the infection control programs, is used to evaluate compliance during recertification survey, and also used for focused infection control surveys. So this first page of the document, it basically has some information for the first surveyors to use. about what tags are going to be evaluated. It has some definitions about, what constitutes staff, what, things they're really going to be looking at, and the evaluation of the infection prevention and control program. And it also tells you what is included in the focused infection control survey. So they're going to use this infection control pathway for your focused infection control and everything except for your water management, laundry services, and antibiotic stewardship. Next slide. So this is the first page of the checklist itself. Each surveyor is going to coordinate the evaluation of the infection control program for each facility. So this first tab here, we have coordination. Each surveyor is responsible for assessing the facility for breaks in infection control throughout the survey, and is to answer CEs of concern, such as standard transmission-based precautions, source control. It indicates that one surveyor is to perform or coordinate the facility task review for the following subjects. So these are the things that everybody is going to be looking at when they're doing your infection control portion of your survey. So we're going to look at standard and transmission-based precautions, the infection prevention and control program, including your standards, policies, and procedures. We're going to look at infection surveillance, water management, laundry services, antibiotic stewardship program, information about the infection preventionists at your facility, and also your immunizations such as influenza, pneumococcal, and COVID-19. So they're also going to take a sample of your residents and staff, and it tells you exactly what they're going to be looking at when they do that sample. So they're going to sample one staff to verify compliance with requirements for educating and offering COVID-19 immunizations. They're going to sample 3 residents on transmission-based precautions. They're going to sample 5 residents for influenza, pneumococcal, and COVID-19 immunizations to review. All right, so that's how the evaluation itself is going to be laid out. Then it goes into specifics about what they're going to be looking at. So, general standard precautions. Staff are performing the following appropriately. So they're going to go through and, see what your staff is doing. They're going to look at residents, visitors, and others at the facility to see if they're using appropriate source control. If there's a known outbreak at your facility, making sure you have the proper signage, and that you're managing the outbreak appropriately. They're going to look at hand hygiene. So, are they using appropriate hand hygiene practices, such as alcohol-based hand rubs or soap and water? Everything's being followed appropriately. And just to note, every surveyor, whether they're over the infection control portion or not, they're going to be looking at these things. So just, your education for your staff and, residents, that should be a forefront of your mind as you're going through this. So this next page, continues with hand hygiene, and it's telling you exactly what they're looking for. That the staff is performing hand hygiene, even if gloves are used in different situations. And when you're reading through this document, you need to be thinking about, what are the current practices that we have in place right now? And if you're not meeting these, what can we do to improve them? What kind of things can we put in place to help with this? Because, like I said before, these are the critical elements that need to be in your infection control program. We're going to move on to PPE for standard precautions. Determine if staff appropriately uses and discards PPE, including but not limited to the following. So are they using gloves if they are in contact with blood or body fluids, mucous membranes, non-intact skin, and all these different situations, and these infection control evaluations, looking at your staff, they might be incorporated into other observations. So let's say they asked to watch a staff member do a dressing change. They're going to be looking at not only how, the dressing change is performed, but also, are they using gloves? Are they using the proper PPE? If a splash is anticipated, are they using a gown? So all these standard precautions are really important. Next slide. They're going to interview appropriate staff to determine if the PPE that is needed is readily available. And if they know who to contact for replacement supplies. So, are there sufficient PPE supplies to follow the infection control guidelines? And, if it's not, what is your facility doing to address the issue? How do you obtain PPE supplies before providing care? Who do you contact for replacement supplies? So all those things need to be addressed, and your staff needs to know it. I always say, when I do my on-site visits, we're, talking through policies and procedures. It doesn't matter if you have the perfect policy for it. If your staff doesn't know what to do, then, it's all for nothing. So just make sure that you're properly educating your staff and that they know what they need to do in these situations. For transmission-based precautions, determining if appropriate transmission-based precautions are implemented, included but not limited to, a resident on contact precautions, on droplet precaution, airborne precautions if you have those capabilities at your facility. If a resident has an undiagnosed respiratory infection, are you using, precautions in case, they do develop something in a confirmed case of something in the future? So, that donning and doffing, I know everybody, has been educated on that 100 times, but making sure that we keep up with that education. They know what they need to do for different types of precautions, and if they're not sure, that they can look and see what precautions they need to take. If you don't, this is just another note, if you don't have anything in place at the moment that your survey happens, they may go back and look at records of, what you did to address these things for past cases. So they'll observe staff to determine if they use the appropriate infection control precautions when moving between resident rooms. Are they doing the proper hand hygiene? Are they disposing of their PPE properly? Those are all things that they'll be looking at. They'll interview appropriate staff to determine if they are aware of the processes and protocol and how staff is monitored for compliance. This is where your hand hygiene and PPE audits can be helpful. Okay, next slide. So, going through all of those things, if everything checks out, this first question, that the surveyor will need to answer: did the staff implement appropriate standard precautions and transmission-based precautions? And they'll click yes if, everything is on the up and up, and no if, they do assign a tag for your facility. All right, the next thing that they'll look at is the infection prevention and control program, your standards, policies, and procedures. So they'll look at all of your infection control policies and procedures and make sure that they are current and based on, what is actually happening in the facility. So they'll look at if the facility's policies and procedures include which communicable disease are reportable to local and state health authorities. They will look at, if the staff can identify the protocol for communication to those health officials, and make sure that your policies are reviewed at least annually. And this is key. You have to look at it, even if you don't change anything, look at it, make sure that it's, up to best practices and current infection control standards. Okay, so that review of your infection prevention and control program is going to, lead to this next question. Does the facility have an infection control program, including standards, policies, procedures? And they will put yes or no, based on what they find. For infection surveillance, again, they'll look at your infection surveillance program to see, if you have the proper components in there. These are the things that they'll be looking at. Facility prohibits employees with a communicable disease or affected skin lesion from direct contact with residents, their food. If direct contact will transmit disease, staff are excluded from work according to national standards. So, they'll check yes or no for that. And they'll go down the list of all the different components of your infection surveillance program to see if it's appropriate for the situation. Next slide. And they'll continue these questions, about the processes, about, what components of your surveillance program are there. And, the third question, did the facility provide appropriate infection surveillance? Yes or no? They'll look, and then, they'll sign a tag if they find it's not sufficient. Water management, thorough interview to determine if the, facility has assessed the water management program where Legionella and other opportunistic waterborne pathogens can grow and spread. And, what measures have been implemented to prevent the growth of Legionella, other waterborne pathogens, how it's monitored, and if your facility did have a resident with Legionellosis since the last recertification survey, they're going to want to talk to the IP to determine how that case was handled. And, again, they're going to look at it and see whether or not the actions were sufficient and, decide whether or not a tag is appropriate or not. Laundry services. Again, we're going to go through the laundry and decide whether staff handled, stored, and transported linens appropriately. And it has all the components that it's looking for. Are they using standard precautions? Are they holding contaminated linen and laundry bags away from their clothing and body during transport? Bagging and containment of linen, was that appropriate? Next slide. They're going to look at transporting contaminated linen in separate carts. If it's not possible, the containment linen cart should be thoroughly cleaned and disinfected. If there's a laundry chute in use, laundry bags are closed, no loose items. They're going to take a look at your laundry room to determine whether staff is maintaining the machines. If there's any evidence of, a maintenance log or record of any outlying situations, if they're using the proper detergents, additives, or any other chemicals for laundry according to the manufacturer's use. And if there's any outliers, they'll address that there. Another thing they're going to look at, and this is going to be pretty heavy, is antibiotic stewardship program. They're going to determine what your antibiotic stewardship program entails. They're going to ask about whether or not the facility has an antibiotic stewardship program in place that includes all of these different components, such as written antibiotic use protocols, protocols to review clinical signs and symptoms, and laboratory reports to determine if the antibiotic is indicated. They're going to look at if there's a review of antibiotic use by prescribing practitioners. So all of your reports, if you have them, for who is prescribing antibiotics, what types of antibiotics they're prescribing, how the tracking of that is communicated to the providers that are, prescribing these antibiotics. These are things that they're going to want to see. And also, if there's any concerns with the antibiotic stewardship program, the surveyors will complete an investigation, about what components are outlying. Next one. So, this antibiotic stewardship program component is really important. And not only the IP, leadership and the physicians there, but also your staff may be asked about this. So they'll want to know, about the antibiotic stewardship program from their perspective. And sometimes frontline staff is not aware of that term. So educating your staff on, the terminology around antibiotic stewardship. And then also, sometimes staff is doing components of antibiotic stewardship. They don't really know to, connect the dots, if that's what it is called. So just making sure that there's some education for the frontline staff, that they know that this antibiotic stewardship program exists and what their role of it is. All right, so the next section they're going to look at is about your IP. So it's going to ask you information about your infection preventionist. Do you have a designated infection preventionist? They want to know if they're working at least part-time with your facility. They're going to want to know about how your infection preventionist has been trained. So, as a part of your infection control documentation, if you have a binder or some sort of file somewhere, having your infection preventionist information, maybe, their resume, CV, their certificate from their infection control training, that's always helpful to have on hand as you're going through this process. And, it has, information about the professional training. So that's why the CV is really important, and their certification for infection control. And as far as the immunizations, as I mentioned earlier, they are going to want to review the records of 5 residents for their influenza, pneumococcal, and COVID-19 documentation. So what they're going to be looking at is the screening and eligibility, the provision of education. Have the residents have been educated on these immunizations, and either the record or administration of the vaccine, or some sort of documentation about a declination. So they're going to know about that. And also, facilities must follow the CDC and ACIP recommendations for vaccines. So if the survey, next slide, I'm sorry. If the surveys do occur during the influenza season, unavailability of the influenza vaccine can be a valid reason why a facility has not implemented the influenza vaccine program. But there's, you'll need to demonstrate some different components of why that's happened. Like, the vaccine has been ordered, or there's some other plan to, get the vaccine and have it administered when they're available. And also, there has to be a plan in place to screen for and administer the pneumococcal and COVID-19 vaccines as well. And make sure that the residents are educated about, the benefits and potential side effects of the vaccine, and, how the vaccines are screened, how the residents are vaccines, how the residents are screened for the vaccine, sorry. So, those will be evaluated, as well as also the education for COVID-19 immunization. And the last component is the education and offering of COVID-19 immunizations for staff. So the facility will have to have documentation of, how staff was screened for their eligibility, and also, what kind of education was provided to staff about the vaccine, and, how, it's being recorded, whether or not they have either had the vaccine administered or some sort of declination. But that all has to be, pretty well spelled out. So those are the deep dive components of the critical element pathways. Again, these are things that are essential to your infection control program. I know a lot of people are worried about the new update with the enhanced barrier precautions. That is going to be surveyable. So, keep an eye out for updates to this document. The critical elements pathways document with specifics about what's going to be evaluated, because that information will be available. Like, how is this requirement going to be evaluated? So, I know the quality improvement specialists reach out to you guys often regarding these updates to the protocols, but also keep an eye on our last minute lowdown, because we always have, updated information when we have huge changes like this. So I guess we have some resources available here. And if you have any questions or concerns, you want specific information about different components, you could always reach out to Deb or me. We'd be happy to help you with that.
Thanks, Jen. And the last thing that I want to say before Kathy goes into her closing remarks is, while that critical element pathway was 9 pages, some of them are not, some of them are short and sweet, some of them are longer. It doesn't mean you have to do each section of it. So if you are strictly working on a copy plan for immunizations, then pull that critical element pathway and just go down to the immunization section and work through those steps to make sure that you have all the components in your processes. So it's not like you have to do each step of it when you pull that critical element pathway. Just pull out what's pertinent for what you're working on at that time. Kathy?
Thank you, Deb, and thank you, Jen. At this time, if anyone has any questions, please submit them using either the chat or the Q&A tool in your Zoom menu. I see that someone already has a question in the chat. If Deb and Jen want to look at that while I go over our closing remarks. Another option is you can raise your hand if you would like to request to be unmuted to ask your question out loud. And while you submit your questions, I'd again like to invite everyone to next week's webinar, which will be a replay session of our recent webinar on increasing infection prevention with interactive education, followed by a live Q&A. And that webinar will be next Wednesday at 2 p.m. We also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. Deborah Wright or one of our other quality improvement specialists will be there to answer your questions on topics like our quality improvement initiatives, infection control, or MDS coding. You can find the links to our live chats and our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudell@qualityinsights.org and I will get you on the list. And I'll drop my email in the chat in just a moment, along with Deb's email and Jen's email. And I'll read that first question that we have in there. It says, my administrator asked, will you be offering NHA credits for infection control since the new regulations went into effect?
So I will answer this question very broadly. I believe you're asking, will we have NHA credits, not necessarily for what we talked about today, but just in general for the NHA in relationship to infection control to keep the license active with their CEs. I do know that our medical director is working on some offerings that will have nursing and NHA credits. And this is an area that we are looking at, not only for the administrators to meet their credits for infection control, but also your medical directors. So that is something that we are working on. And once we have more information on that, we will make sure to get that out to the group.
All right, thank you, Deb. And they said, thank you so much. If anybody else has any questions, please submit it at this time or raise your hand because I think we'll go ahead and wrap up. Deb and Jen, do you have anything you want to add before we close?
Nope, I am good. I just want to reinforce that those critical element pathways, not to sound cliche with the title, but they are critical to helping you make sure that you're meeting all the things that the surveyors are going to be looking at. So if you are looking at an area, while the critical element pathways are not all inclusive, obviously for every regulation, but there are a lot of them there that can help you kind of guide your policy and procedure and guide your staff education for those specific areas.
Absolutely. I, agree with Deb. These are things that facilities can look at, and just sort of, guide, what their program is. So.
All right, thank you, Jen, and thank you, Deb. And I will close us out. And I was going to mention again that I'll be emailing the slides, a link to the slides and the webinar recording later this week to everybody who attended today, if anybody wants to go through that again and be able to walk through all the screen sharing that we did today. All right, so I'm going to head and close this out. Before we sign off, we'd like to ask everyone here today to please answer a short evaluation of today's webinar. It is anonymous and will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer and Deborah, thank you for joining us again. And we'd like to thank all of you for joining us, and we hope to see you back here again next week.